How to support a risk adjustment diagnosis. Knowing documentation guidelines is the key. Lesson objective. Healthcare providers will learn how to support every single risk adjustment diagnosis documented in the notes. In this module, we will cover the following topics: documentation and coding guidelines, documentation for support and validation, characteristic of a good documentation, examples of invalid documentation, the MEET strategy. Since the medical record documentation is essential for coding and reimbursement, the documentation must be clear and complete. Healthcare providers must clearly describe each medical diagnosis to the highest level of specificity. They should ensure the medical record documentation is not conflicting, contradictory, imprecise, incomplete, inconsistent. The documentation must include all condition evaluated and treated, all chronic conditions that affected patient care, treatment or management, date of service, patient name, and date of birth, healthcare provider name, credentials, and timely signature. Vague code descriptions. Some electronic medical record systems insert vague ICD-10-CM code descriptions into the medical record as final diagnoses, for examples: other secondary pulmonary hypertension, other cardiomyopathies, diabetes with other specified complication. The diagnosis will not be complete with a vague description unless the healthcare provider clearly documents the specific other condition. Healthcare providers must not list the code number or select a code number from a list of codes in place of a written final diagnosis. It is the responsibility of the healthcare providers to provide clear, legible, and specific documentation of a diagnosis, which is then translated to a code for reporting purposes. As a healthcare provider, it is your responsibility to describe the diagnosis and its etiology, acuity, and manifestation. Since codes are not medical diagnoses, good clinical documentation must consider coding guidelines for reimbursement purposes. Accurate and appropriate documentation with specific coding indirectly affects patient care through reimbursement. Therefore, valid documentation as it relates to code abstraction for ICD-10-CM is a must. Avoid putting a red flag on your documentation. Just learn, know and apply the guidelines.